Hi there. It's Amanda at the National AIA Resource Center. Thank you for joining us for today's learning cluster on taming a many-headed dragon, building interagency collaboration. We have Melissa Sienna, project coordinator of SAFERS, and her collaborative partners in Hartford, Connecticut. We will be recording today, and this will be available for other grantees as well as the general public. Please hold your questions until the end. We'll try to keep your lines muted if you're participating, but if you have the option to mute your phone, please go ahead and do that. We will make sure that we save some time at the end for questions, at which point we will unmute the lines. And at this point, I'd like to turn it over to Janet. Thank you guys so much for being here with us today.
Well, thank you for asking us. We certainly appreciate this opportunity. So this is Taming a Many-Headed Dragon, Building Interagency Collaboration, but not just any agencies, state agencies is what we're talking about specifically. Okay. I am Janet Story. I am a Behavioral Health Program Manager at the Connecticut Department of Mental Health and Addiction Services. I will start and finish the presentation today. I'll be passing it off to Chris Lau, Marty Boyer, and Jane Ungemak. Okay, I wanted to give a little bit of context for this presentation because it's my understanding that there are a variety of programs listening today. This collaboration has been developed within the context of addressing parental substance abuse. It began with a program called Project SAFE, which was started at the Connecticut Department of Children and Families, which is our child welfare agency. And it is a program that refers parents who are involved in the child welfare system to assessment for the severity of their alcohol or drug use, and then, if appropriate, treatment afterward. Over time, and I'll go through in a few slides what the exact development process was, but over time it's become both a policy and a practice. It's evolved into other more collaborative programs, and we do a lot of collaborative policy setting as well as operations management down on the at the program level. We have endorsement from judges and attorneys. One of the main successes of this is to make sure that people who need treatment, specifically parents and caregivers, have priority access to treatment. And they also receive recovery case management services, which helps them to keep their recovery together over time. And we have an evaluation component that we will also talk about in a little while. Our system partners, as I mentioned, include the Department of Children and Families, our child protection agency, and DCF is also responsible for providing children's mental health and substance abuse treatment services. I'm from the Department of Mental Health and Addiction Services. We are the adult mental health and substance abuse treatment service provider. We contract with other agencies for the most part to provide those services. And we also offer wraparound services such as supported housing and supported employment and those types of things. We also collaborate with the Court Operations Unit of the Judicial Branch. They handle child protection, delinquency, and families with service needs. And our administrative services organization is Advanced Behavioral Health. They take care of our utilization management, so they manage the network of service providers who actually conduct the evaluations or the assessments and the treatment. They also research and disseminate best practices and manage our health information technology for these programs. Other key partners include, I can't do two things at once.
Do you want me to do that for you?
Yes, would you please do that?
Collaboration in progress.
Yeah. Yes, that's collaboration at work. I can't speak and operate the mouse at the same time. Other key partners include the Chief Public Defender's Office, the Office of the Attorney General, and the Yukon Health Center Evaluation Team. We'll talk about those a little bit more in a little while, too. So here's the sort of process that evolved over time in this collaboration. As I mentioned, it began in 1995 when DCF established Project SAFE. The purpose was to reduce child abuse by linking together the child system with the adult substance abuse treatment system to make sure that those parents were connected to treatment. In 1999, my agency, DEMAS, the Department of Mental Health and Addiction Services, joined the collaboration formally to help broaden the scope of services for families, and that actually led to legislation requiring that our two agencies develop a memorandum of understanding that we would continue this collaboration to help families. In 2005, DEMAS and ABH decided to change a drug testing policy that we had, and we redeployed those savings to offer outreach and engagement to the families because they just weren't using the services. Either there was a very low rate of low show rate for people going to the assessments, and there was really not as strong a connection to services as we wanted to have. So by changing around the way we funded things and developing some new ways of practicing this, we were able to increase our utilization a great deal. In 2007, we received IDTA and technical assistance from NCS-ACW to implement a pilot of a program that we call RSVP, Recovery Specialist Voluntary Program, and that provided a much more integrated system of care for the families that we jointly serve. Then in 2008, we joined together with the judicial folks, one of whom is going to speak in a little while, and we all signed an MOA with Yukon formalizing our collaboration and adding the evaluation component for this new program that we were developing through the IDTA. And here we are in 2014-15, and we've leveraged some funding with AIA to expand our scope to include substance-exposed infants, including fetal alcohol spectrum disorder and neonatal abstinence syndrome. And so this has all come about from having a common mission and a common goal. We all wanted to improve child well-being by addressing parental substance abuse. A very high number of cases, as we'll talk about a little bit later, of children in the child welfare system have family substance abuse, and that was the reason they were being removed, and we all felt that we could do a better job at that. And then we also wanted to increase our capacity across our large state systems to better serve families impacted by substance abuse. What it took initially and what it has taken over time was top-to-bottom commitment. We were talking last week about how the collaboration really began organically at the ground level with the people working directly with the families and seeing the substance abuse and not getting the results that they wanted. And as these ideas and collaborations were developing on the ground level, we came to the point where we needed operational leaders at the policy level and at the central and field offices to all get together and be on the same page. But the collaboration really blossomed when we got the okay from leadership in both word and action from the commissioners, from the senior state agency managers, and the administrators of the judicial court. That's when it really took off, because we had that strong backbone for the entire collaboration. One of the things that we do every year, and it's really very moving, and I think it goes a long way towards sustaining our commitment, is that we have celebrations where we actually have the families come and they talk about how they're doing, and the commissioners get to see it, and we all get to see it, and we remember why we're all in this boat together. Now I'm going to pass it on to Chris.
So good afternoon. Again, my name is Chris Lau, and I'm a regional administrator at the Department of Children and Families. And I'm going to just speak a little bit in this first slide about the steps that we took to build our collaboration. So sort of building off of what Janet just described around the history of a collaboration, we agreed that we had a shared problem. And in that, DCF, for us, our clients who had been identified as needing substance abuse treatment were not showing or engaging in substance abuse treatment, and that was having an impact on their case plan, and specifically for those cases where children were in the foster care system, the ability to reunify was taking much longer. With respect to DEMIS, as you heard Janet mention, they were experiencing, the treatment providers were experiencing high no-show rates, and families who were not, or parents who were not engaging in treatment, and that was really placing a strain on the system. And for the court, they were challenged really by the same thing, similar to the child welfare system, that treatment challenges were impacting permanency planning and cases really being moved through the court system. So we focused our conversations on mutual outcomes, again, getting this population engaged in treatment and recovery so that we had an impact on a child welfare outcome. We left our turf issues at the door. We were 3 very large systems, but we were committed to working on the issues. We brought humanity, humor, and celebration to the table. We met and still meet once a month. We've established friendships and camaraderie. In fact, while we were waiting for this webinar to begin, we had to mute the system so that we could keep chatting about our weekends and our children and so on. And so over time, obviously, we gradually built trust and support of a unified goal. And we really did that by agreeing to follow up on matters that needed some resolution in each of our own agencies, obstacles that we needed to overcome. So the structure of Connecticut's collaboration is around these sort of 4 areas: policies and practice, and that really had an impact on our common goal, policies and practices. Staff development, being committed to offering training opportunities. Braided Resources, which allowed for implementation of some actual service delivery to the population that we were looking to serve, and a shared data and evaluation component, which was obviously important to determining if we were meeting the outcomes that we had established. So around policy and practice, you heard Janet talk about a memorandum of agreement or a memorandum of understanding that we've established between the 3 systems, DCF, DEMIS, and Judicial. It took a while, but we stayed engaged and made it happen. That was to formalize our commitment to each other and to the process and define our roles. There is a collaborative decision-making body for oversight and implementation of the work that we're doing. Again, mentioned that core, what we call core team, who has been meeting for several years and meets regularly to really flush out things around policy and practice. So policies articulate mutual solutions, making sure that practices are a good fit for all partners. So regarding the Braided Resources, again, we began with a small pilot project that you heard Janet reference called RSVP. It's the delivery of recovery case management and supports for clients who are court involved in the child welfare system, specifically at the first point that we have removed their child on what we call an order of temporary custody. And so that really tested and strengthened our collaboration as we began to develop and implement that. We developed joint contracts that specified who was going to pay for what and under what circumstances. So we already had some of this experience, early on, as you heard about Project SAFE and that started with DCF, but then DEMIS joined, and so we really just built on that experience. And then the creation of the braided funding, where each partner is able to keep track of how its own dollars are being spent, really keeps us mindful of our contribution and held us accountable to ourselves and actually to each other. So the last piece I'm going to talk about, I think, is on staff development with respect to our two systems, DCF and DEMIS, well, and actually judicial. I think Marty, you'll talk a little bit more too on that. But we did some cross-systems training to understand each of our missions, policies, and practices. We did some really basic 101. What's it like at DCF? How do you work a case? What do our line staff do? What are they engaged in, and so on, for as far as DEMIS and the court. We talked about the constraints and timelines under which each agency operates. Particularly for the child welfare piece around our federal permanency timelines that we operate under when kids are in foster care or they're in the system, and we share that timeline really with judicial and the court, because we do that work with the court. And then certainly DEMIS's timelines and constraints around treatment for their clients and so on. And again, we talked about shared values and interests and looked at what our commonalities were, not only what our differences were. We had some workforce development by content area, so we designed a cross-systems training work group that was a part of our core team. We had state-of-the-art knowledge in each system that we shared. So, for example, we had several opportunities to send staff to courses, if you will, or trainings on the biology of addiction, recovery 101, motivational interviewing, trauma-informed care, so that we were learning some real content area. We were looking at the effective positive changes to agency cultures. So for the child welfare system, we began to use recovery language. For DEMIS, they began to use language around permanency, safety, risk, and well-being. And again, the court's language is also, they have their own language. Let's put it that way. And again, part of the staff development was around developing a common language, and we did that not only in training, but we also did it in collaboration around actual cases that brought us together to troubleshoot. So that is my piece, and I'll turn it over now to Marty.
Okay, my name's Marty Boyer. I'm a court service officer in the juvenile court here in the state of Connecticut. I work for the judicial branch under the auspices of the court operations unit. My qualifications were both in mental health, social work, and legal social work. So this position kind of marries both the mental health area as well as the legal area. So that's just a little bit of a background for you about where I'm coming from. So I do work in the court every day. I work with lawyers, judges, DCF, and service providers and the parents. Now in terms of staff development with the judicial branch, the first thing that we needed to do was to engage our Chief Justice or her designee, which was the Chief Court Administrator, and the Administrative Judge for Juvenile Matters. These are the two key people that had the authority to sanction a collaborative effort. Our court services officer's manager had an already existing positive working relationship with these two key people in the judicial branch and was able to introduce the concept of a collaboration with the Department of Children and Families and the Department of Mental Health and Addiction Services. Through several meetings with these two key figures, she was able to bring these two key figures into a process of developing the collaboration between DCF, DEMIS, and the judicial branch. we were able to show the judiciary how this collaboration would assist the judges and the lawyers who practice in the child protection court system. So how did we exactly do this? Well, first of all, good relationships are crucial. Positive working relationships with judges is really essential. The Judicial Child Protection Coordinator had many meetings with these judges to build a well-informed and trusting relationship and to keep them invested in the process. Ongoing communication through emails, telephone, and face-to-face meetings was really essential on an ongoing basis through the years. The coordinator kept the judges up to date on the process as the IDTA process was becoming more of a real possibility. Asking for the judges' input and guidance, listening to their concerns and ideas is an important part of engaging them in this process. And by maintaining ongoing communication with the judges throughout this process, it kept them engaged and invested. As for positive impact on outcomes with no impact on timelines, we introduced the possibility of a positive impact through this collaboration with the courts. So we explored with the judges how this collaborative effort could assist the court with meeting the federal permanency regulations. So this is an example I want to give you as to how we did this. There's specific federal laws and regulations for permanency timeframes for kids who are in the foster care system. One positive outcome of our collaboration was the fact that we are now able to identify early on in the court process parents who have lost custody of their children due to substance abuse. Through ongoing court intervention via the court services officer, and that's the position I fill, and through case status conferences, which is what I run. These are conferences that all of the parties will attend. The court is now able to keep an active pulse on these cases, support and hold the parent accountable on a consistent and frequent basis, and assist in getting the treatment these parents need. Therefore, the reunification process is expedited and very often successful. We also brought to the judges' attention that we could conduct cross-training. Through this collaborative effort, cross-training for all the disciplines was provided. This offered a window of opportunity for each discipline to learn about each other's responsibilities and obligations. It also informed the bench and the lawyers about substance abuse, its effects on parents, parenting ability, and what treatment services are available. And this was quite eye-opening for judges and for lawyers as they are not trained specifically in addiction. We also suggested that we could provide additional resources for the court that would be at no cost to the judicial branch. This process offered additional resources for the court to draw upon at no cost. The judicial branch is involved in braided funding on one issue, and that's through cross-training efforts through our Court Improvement Project grant. Court role and accountability. Holding the parent accountable for their recovery process is key. This is done both in court hearings as well as in case status conferences, which are held in the courthouse. The case status conference is a court-based meeting facilitated by a court services officer where all the parties involved in the case meet to discuss legal and non-legal issues. In the case of parents who lost custody of their children due to their substance abuse issues, this becomes a place where all the parties can specifically address how the recovery process is going for each parent. This is a forum where the parents can be applauded for their ongoing efforts in treatment, developing their sobriety, and focusing on self-recovery. It is also a place to address any concerns the parent, DCF, or service providers may have. Regarding information sharing and confidentiality, this collaboration led to information sharing between the key stakeholders. Through this process, DCF, the service providers, the lawyers, and the judicial personnel met to discuss areas of concern and to brainstorm about new ideas. Positive working relationships among these three disciplines had developed, and it is helpful today in maintaining this collaborative effort. Engaging lawyers who practice in the Child Protection Court is absolutely essential early on in this process. Asking them for their concerns and ideas is very important. Confidentiality was a key concern for lawyers who represent parents in child protection matters. Therefore, we were able to develop a confidentiality agreement between all the stakeholders that would address the lawyers' concerns and protect their clients in the court process. And last but not least, which I did not put on a slide, I want to talk about one thing that was really an outcome that we didn't even plan to have, is that we were able to destigmatize the issue of parents who struggle with substance abuse. Through this process, the judiciary and the lawyers became educated and informed about substance abuse and the difficulties these parents face in developing their sobriety. These cases are now seen by the court through a lens as a human issue as well as a legal issue. And now I will turn this over to Jane.
And I'm the farthest away. I hope that everyone can hear me. I'm Jane Ungamack. I'm Jane Ungamack. I am a researcher at the University of Connecticut. I have worked with state agencies for decades now. And I was brought into this process back in 2009, about the time of the IDTA, and I really was brought in to assist with one of the main components of this collaboration, and that is data sharing, but also using data for informing the planning, the program development, and then the evaluation process to look at the impacts of these program changes and policies on the status of families who were substance involved in the child welfare system. So we was agreed early on that partners wanted to have an evaluation in place, especially around the pilot program that they were beginning, and it was intended to be a formative evaluation, but also looking at process and outcomes. The very first thing was, after identifying what the specific goals of the project were, and I believe Chris already articulated that it included increasing access to treatment services, engaging these parents into treatment. Also, it included impacting the length of time that children were in out-of-home placements and the time to decisions making at the court level for children's placement, and also looking to reunify children who had been taken out of the home, if indeed possible. So we started looking at every participating agency's data that were relevant to these goals and that were also relevant to describing the population. One of the first challenges was, even though there was widespread agreement that substance use was a incredibly significant problem in the child welfare population, and research data had been saying that 60 to 80% of child welfare cases are likely to be abusing alcohol or other drugs. There was really no hard data, if you will, identifying how much of a problem it was in the child welfare system. So we started looking into DCF's data to see how many of these cases could be identified as substance involved. And when we looked at it, we found it wasn't quite as high as the 60 to 80%. In fact, it was only about 1 out of 3 cases that were being systematically identified in which the parents had a substance abuse problem. So, but that is a significant proportion of the service population. We also looked at DCF data to determine whether parental substance use was impacting on child outcomes. And in fact, we found that children whose parents had a substance abuse problem were staying significantly longer in out-of-home placements than in those cases where there was no substance abuse involvement. So it really started to create the basis, data-driven basis, for identifying really the scope of the problem in Connecticut, which also, by the way, helped to bring more buy-in to and broader recognition that it was a problem in the state. Looking at each agency's data, we had to really assess the quality of the data and determine whether or not it was easily accessible for analyses. And I'm going to touch a little bit upon that in my next slide. And then I should also say, you already heard that we've been meeting on a monthly basis now. The management team, and that has included both state agency managers as well as regional and area directors and managers, so that there's a constant flow of information, but that flow of information also includes the evaluation team reporting as well as ABH reporting what census data, how the system is being used, and characteristics of the clients being served by the program and the outcomes that we've had from the program. So these also, some of this data, not only is it identifying client needs for additional services, it's also helping to inform training, better coordinate services, and, as I mentioned earlier, impacting the impacts of the program. Let me say a little bit about the different data systems, because this represents one of the challenges. I have found in my many years of experience working with agencies that they may collect a lot of data. They don't always use that data, and when data aren't used, sometimes it creates a challenge in terms of quality. But we also have certain assumptions about what's there. First of all, working with DCF's data is child-centered. You know, their concern and their focus is on child in these families. So the data about the parents is less systematic, if you will, not as well collected and as comprehensive as what they have for the children. But those data can be used to really count the numbers of children involved, the numbers of families involved, and certain characteristics of those cases. Those data are also useful to find out something about outcomes, including family reunification, child permanency, and reentry into the child welfare system once they're discharged from services. However, I should note that although there are really massive amounts of data collected on each case, the data are really, for the most part, in narrative form. So they are not easy to access. So we do not, generally DCF does not have systematic data available to describe their population. What we did end up having systematically from DCF was information on the family strengths and needs in terms of services, including identifying whether substance abuse was a problem. We also thought we would have the safety assessments available that are supposed to be done at regular intervals. And I would say the DCF managers, when I presented the data that we had on safety assessments, they were quite incomplete. And that, I think, was a shock about that. We ended up not being able to use the safety assessment data. But I think the lesson in there is you really have to very systematically look at the data, see if it's saying what you expect it to say, that it really is the information you believe it's going to be, that is going to be relevant to your purposes. Now switching to DEMIS. DEMIS, the adult treatment system, is focused and collects data on the adults entering their treatment system. I would say their data is very comprehensive from the statewide perspective because it is inclusive, or the reporting is supposed to be done by all licensed programs. It's not 100%, but where there's a little breakdown is private programs, privately funded programs, and facilities are probably somewhat less likely to report into the client-based system, but it's definitely comprehensive of the publicly funded system. So that data system can provide information on the numbers of these parents who are entering into treatment and the types of substance abuse problems they have, the level of care, the demographic characteristics, information that is routinely collected by DEMIS. And I should also note the best place to often find systematically collected information from public agencies is the data they have to report for federal purposes. So that's almost always systematically collected and of pretty good quality. Switching now to the judicial system, no surprise, they are child-centered, just as DCF is, because they work very closely together. They have much of the same outcome data, but they also have information about the court process, the time to disposition, and what the disposition status is, whether there's been a reunification, a transfer of guardianship, adoption, those sorts of things, so that we could monitor outcomes, child outcomes, very well through that data system. A little bit more limited in a way, but still totally relevant to the purpose of the programs we were looking at. And then there's the services organization, Advanced Behavioral Health, ABH. Here we were getting service information. They do intake, they have discharges, they have routine assessments done. So through this, we can capture the information on the number and characteristics of clients served, in this case by RSVP, but we can also do it for other programs and have been doing it for other programs. We can capture the timeliness of from the point of intake to referral to treatment services and entry into those treatment services, the monthly functional assessments covering things like mental health, substance abuse, parenting, functioning in everyday life. And we can capture information about their program participation and discharge status. I took the opportunity to just illustrate the kinds of data that we were collecting and that was relevant to the services here. Given that all of these are parents who have a substance abuse problem, and I should say that of those referred through the DCF and the judicial process for at least RSVP, almost all of them met criteria for treatment need. So they were accurately identifying cases who needed substance abuse treatment. In addition to that, we were finding that they had involvement in other systems, other problems that undoubtedly impacts upon the recovery process. So almost 2/3 of them reported that they had been involved in the criminal justice system, and most of those were still currently involved at their entry into our program. The domestic violence and trauma rates were high. coming up close to 40%. We think those rates are low, that there's a lot of sensitivity about reporting those things, but even so, these are significant proportions of our client population who have these problems. Co-occurring mental health problems, this is pretty much right on target. About half of this population reported that they had a history of mental health problems, and I would say about a third, not showing here, were actually currently in treatment for their mental health problems, most frequently things such as depression, anxiety. The majority were unemployed. So their resources, the poverty levels are very high in this population. Again, speaking to additional needs for recovery services. And the vast majority, and these were mostly women, 4 out of 5 were women. The majority were not married at the time they were entering the program. This speaks to a lack of social supports that many of these clients experience. So all of these things really speak to needs around additional wraparound services, for instance. And then I wanted to give you a peek at the kinds of outcomes that we were looking at for this population. I already noted to you that the majority of those referred to the program needed treatment, but of those who were referred, the majority of them actually enrolled in the program. This was a joint decision between the client and his or her attorney. So 84% enrolled. And of those, the majority were entered into treatment within 30 days. That understates it. It's a higher proportion. It says 68% were there in 30 days. I think it was closer to 75% actually entered into treatment. That was, about, the record with Project SAFE was about 33% of those referred actually entered into treatment. So this was a vast improvement on previous performance. The kinds of services they got varied dramatically. Detox only is not really considered treatment. Those, there's that small proportion who really didn't engage in treatment services. But the vast majority did in fact engage in treatment services. The median length of stay was 88 days. A targeted minimum for optimal treatment effect is 90 days. Some of those are those 6% in detox only. And we had 3/4 of our clients successfully discharged from treatment. We compared that to the statewide average of substance abuse treatment clients, and only 43% of those in Connecticut successfully discharged, successfully completed treatment. So all of these indicators were saying to us that we were having significant impacts on our clients served through these programs.
Is that the end of yours?
And
Yes.
Okay, and so this is Melissa, the program coordinator for the SAFERS project. So the purpose in sort of highlighting the data in particular isn't necessarily that the data is relevant to any one other program the AIA is currently funding or working with, but that we wouldn't have known the breadth and scope of the outcomes, nor of the problem, had we not had access to data across systems. So in order for us to really understand how the program was impacting families and the families' involvement within the multiple systems, we had to have access to that information. We had to have a comfort level and agreements in place to share it so that we can get to this point where we can then analyze it and interpret it as it reflects the success of the collaboration. So even if the program itself isn't related to the work that you're doing, this certainly evidences how a successful collaboration can both document the problem and also the progress. So, moving forward.
Me, Janet again. Okay, sustainability. And just adding on to Melissa's point, the data that are being used across systems is being de-identified, and that really is before the evaluators even see it, and that also really speaks to the collaboration and to sustainability. Our different agencies have infrastructures in place that allow us to work with our data together in a shared way and to match data from the court, from the child welfare agency to the adult treatment data, and then really make it speak out loud rather than just staying inside a server somewhere. I'm looking at this board here, it's something about yoga, and it talks about streamlined, a public health model of initiative for yoga, and it talks about streamlined expenses, shared infrastructure, maximized resources, and shared success. And lo and behold, really that's what our collaboration has been about. So we sustain this progress and this collaboration by, and you have to do a visual here of a red circle with a cross out through it, of not believing in silos anymore. We've really broken down the silos in this case and been able to, through all this information sharing and data sharing and shared risk and shared responsibility, have this shared success. And we do that by recognizing that the way it used to be is no longer satisfactory. Just the absence of symptoms is not enough. We really want to all play a part in helping these families reunite and succeed and be free of substance abuse and have a good life. So a lot of this sustainability comes from each of us taking funding that we already have and putting it into this pot to fund the different services, the adult services, ABH, what ABH does in terms of recovery specialists and all the administrative data and managing the network of providers. Having all of these agreements that are very clear to each of us, that allows us to know we are all doing our part, other than the accountability of meeting once a month. We actually meet more than that for various things. One of the things that came to my mind a minute ago was that DCF and DMIS, in our contract with ABH, we even share the actual contracting process with each other. We have somebody at the Department of Mental Health and Addiction Services that works closely with somebody at DCF, so everybody knows what everybody's doing at any given time. And ABH does a lot of other things for us besides this. When we have savings, we redeploy them, and we are always looking for any sorts of grant dollars that are out there so that we can expand the model. As I mentioned before, now we're going to be able to be addressing substance abuse, substance-exposed infants, and it's all the same collaboration, the same people. One of us even retired, but she's working on this new grant, so we're all together in this. It's also very important to go over the data on a regular basis, to regularly look into the reports from the evaluation and pay attention to what they tell us, to look at utilization all the time so that we know where there are beds, where there are problems. We have one region of our state that we've always struggled to get services to, so we're constantly looking at the utilization there and trying to get them to have better services. We are also embarking on an economic analysis of the initiative, which is certainly very useful to know and to be able to promote the program in terms of continuing or asking for other funding sources. As I mentioned before, we also have our celebrations every year, and that's very, very inspirational, and it convinces us even more that we're doing the right thing. In some of our other initiatives, we are looking at very innovative funding sources such as social impact bonding, which is really something quite really confusing, but it's an amazing thing, and it's a whole different way of looking at the provision of social services. And then sort of to tie up, I want to say that we can't understate the importance of having leadership backing, top leadership backing, but also having people in leadership roles at the meetings and making decisions and addressing problems when they come up. And behind that, I think, is often a lot of private conversations, but it's all always geared toward making the initiative move forward. And to that point, it's really important to listen to each person involved in the initiative. We certainly listen to the parents and try always to provide them with what they need. But things come up along the way that are concerns about the way things are being done or not done, and we don't let any of that slide. We don't go to bed mad. And at the same time, there's always new ideas and different approaches coming down the road, and we have to be aware of those. That, for example, the social impact bonding was something that came along, and it's good to be open to those because it can help make the collaboration even more successful. Of course, in this context that we operate, we have all these different timelines and different goals and different objectives, and some of us are involved in results-based accountability and some of us aren't. But we're always trying to make sure that whatever approach we take, it meets to the greatest degree possible the needs of all partners. Again, participating early, being early on the process, and then consistently showing up and paying attention and being forthright at these meetings is very important. Wherever possible, to build on existing collaborations. We are right now, a couple of us are involved with our Office of Early Childhood and their home visiting programs. And this is a very, very natural addition to our collaboration because these are the people who go to the homes and help parents who are struggling to do a better job of parenting. So we're both very excited about building on adding that collaboration. And at the same time, having reasonable expectations obviously is very important. So there's a thing called the SMART formula to be specific, measurable, attainable, realistic, and timely, and that's what we certainly strive to do. We have a page of resources that you can use to find out more about what our work is. And then in parting, this is our slogan that we have. We embrace safety, permanency, and well-being in substance abuse recovery, and our goal is to achieve positive results for a family that will last a lifetime. And so we can't say enough about building and sustaining collaborations to address a problem like that, and hopefully it'll work for you. So thank you very much from all of us.
Thank you. That was great. I just have one quick follow-up question. A lot of our grantees have been struggling choosing a data system to use. You know, there are so many out there, and they struggle between creating their own in-house and going with something like efforts to outcomes or, you know, one of those data management systems. Which way did you guys go? Did you create your own in-house?
Each of our agencies has their own data system. And I think that's a challenge that is certainly one that all of us are facing, especially those involved with health care, whether it's physical or it's behavioral health, and that as we move towards electronic medical records and shared systems, I think we're going to see a lot of fluctuation in the systems that are going to come and go. It's a really costly process. The states, when they change over their own system, that is a huge deal. DCF is currently in the process of updating its data system and determining what should go into those systems. I think it's clear not everything does go into those systems. I think that very much depends upon the mission, the clients, the whole purpose of your particular agency.
Right.
And who potentially your partners may be in terms of your selection of systems. But that is a gigantic cost and a huge challenge.
I just want to add that I was involved in several years ago in the selection of a data system, and one of the things that we did was sort of a collaborative model. We brought together stakeholders from everybody involved in, this was in prevention, as well as just some outside experts, and we had a limited time work group to, Jane was talking about identifying the data that each collaborator needs or wants, and it's a very useful process to go through at the very beginning to really think through what you need before you actually choose the data system.
Yeah, it seems so common sense, but I do think that piece is bypassed often. And then my final question, sorry.
Can I just say one thing? Because I've seen a number of systems that have been, paid for and implemented over an oh so long time, and they're up and running, and they often prove not to be adequate to the needs of an agency. That you find out, get feedback from those who've already used a particular system and find out what their experience was, because if it's something you want to avoid, you should know as soon as possible about it.
And also, it's not so much what the system contains as how it contains it, because that limits how you can extract it from the system and then utilize the information. So one of the things that Jane mentioned was a lot of the information contained in the current SACWIS or Child Welfare System in Connecticut is in narrative form. That works probably fairly well from a case basis for a worker who just wants to read a narrative, but for an evaluator who then wants to have access to that information to describe the population being served, their needs, characteristics, etc., it's very difficult to work with the narrative data because there's just scores and scores of it. So even if you were to use a qualitative methods approach, it would take, the effort is not worth the outcome, right? So what you're going to get out of that. So it's really important to also think about then how you want to use the data you seek to store. So in what format it needs to be collected and stored in that data system so you can get it out in a way that makes it really accessible and have some utility. So it's really important to understand both pieces of that.
Yeah, and I would also think from beginning to end, what kind of information you're routinely collected and what are those key pieces of information that help your organization understand who you're serving, how you're serving them, and what the outcomes would be. And I think it's very important to think ahead of time what kind of reports you want to, have out of it and how you're going to use the information that you're systematically collecting. And this is my also advice to everybody. As a researcher, the more information, the better. But as an administrator, I would say be very selective about the information you collect. Think it through very carefully. You don't want so much information that you're never going to use.
And that's aligned with your mission. So how will you know when you've achieved your mission? So if you're a nonprofit agency, we're state agencies, but if you're a nonprofit in the community, you have a mission, values underlie that mission, and your question as in your organization is, how do I know when I've achieved my mission? And so I brought us back to the slide around tips for successful collaboration, but the last bullet there is the SMART formula, and that's what you're thinking about when you're thinking about data and data systems. Specific information that measures whether or not you've achieved your goal or mission, that it's measurable in a way that you can then use it, you can attain that information in some way, that it's realistic to obtain it, and that you can get it in a timely manner so that it's meaningful for you. Because if you can't access the information in a timely sense, and therefore respond to changes in needs of your clientele or whether or not the program is being effective, then again it limits the utility of the data that have gone into that system. So that's that's where you would sort of come back and be thinking about it.
Sure. Well, thank you all so much. In the interest of time, I'm going to have us wrap up here. But for anyone who's interested, we have our next learning cluster on June 2nd on utilizing peer workers in your program. And we'll be sending an email out next week to register for that. Thank you all so much. We really do appreciate it. Great information shared here today.
Thank you. Thank you.
Bye.